Vitamin D plays a crucial role in maintaining bone and muscle health, especially in the elderly. A deficiency in vitamin D can lead to serious issues such as osteoporosis, muscle weakness, and an increased risk of falls. To ensure the body receives an adequate amount of vitamin D, it is essential to understand the influencing factors and supplementation methods. The body can synthesize vitamin D when the skin is exposed to ultraviolet B, UVB, rays from sunlight. This process depends on several factors, including age, skin pigmentation, and sun protection habits. As people age, their skin's ability to synthesize vitamin D decreases, making older adults more prone to deficiency. Those with darker skin tones have more melanin, which reduces UVB absorption and subsequently decreases vitamin D synthesis. Additionally, the use of sunscreen and wearing protective clothing can limit UVB exposure, further reducing the body's ability to produce vitamin D. To maintain adequate vitamin D levels, incorporating vitamin D-rich foods into the daily diet is essential. Fatty fish such as salmon, mackerel, and tuna contain high amounts of vitamin D. For example, 100 grams of salmon can provide approximately 361 to 685 IU of vitamin D. Beef liver is another natural source, offering about 50 IU of vitamin D per 100 grams. Egg yolks, with each containing around 40 IU of vitamin D, provide an easy dietary supplement. Mushrooms, especially those exposed to sunlight or UV light, can supply up to 366 IU of vitamin D per 100 grams. Additionally, fortified foods like milk, cereals, and orange juice help enhance vitamin D intake, with 1 cup of fortified milk providing about 120 IU. Consuming vitamin D-rich foods not only supports bone and muscle health, but also boosts the immune system, reducing the risk of chronic diseases such as cardiovascular conditions and diabetes. Furthermore, vitamin D plays a role in improving mood and lowering the risk of depression. Nutrition experts recommend that adults consume approximately 600 to 800 IU of vitamin D daily, with higher requirements for the elderly or those at risk of deficiency. Obtaining vitamin D through food sources is a safe and effective way to meet daily needs. However, when sunlight exposure and diet are insufficient, vitamin D supplements become necessary, and their use should follow recommended dosages and medical advice for safety and efficacy. For adults aged 19 to 70, a daily intake of about 600 IU, 15 micrograms, of vitamin D is recommended, while those over 70 should increase their intake to 800 IU, 20 micrograms, to support bone health and reduce fracture risk. Despite the benefits of vitamin D, excessive supplementation can lead to serious side effects, including hypercalcemia, which causes nausea, vomiting, loss of appetite, excessive thirst, frequent urination, and muscle weakness. Moreover, calcium accumulation in soft tissues can damage the heart, blood vessels, and kidneys. To prevent these adverse effects, it is crucial to consult a healthcare professional before taking supplements, as vitamin D dosage varies among individuals. Before starting vitamin D supplementation, consulting a doctor is essential to determine individual needs. A medical professional can assess health status, identify deficiencies, and recommend appropriate dosages, while preventing potential drug interactions that may cause unwanted side effects. Additionally, doctors can monitor the supplementation process and adjust dosages based on the body's response, ensuring both efficacy and safety. For vitamin D to function effectively, the body requires sufficient magnesium, a vital mineral that activates vitamin D and aids in calcium absorption. A magnesium deficiency can reduce vitamin D efficiency, leading to bone and muscle health issues. Therefore, consuming magnesium through diet or supplements is necessary to promote overall health. Magnesium plays a key role in converting vitamin D into its active form, enhancing calcium absorption. Without adequate magnesium, vitamin D cannot be metabolized effectively, impairing calcium absorption and negatively affecting bone health. Magnesium also contributes to bone structure formation, improving bone strength. To ensure adequate magnesium intake, one can include dark leafy greens such as spinach, kale, and Swiss chard, which are rich in magnesium and other essential nutrients. A cup of raw kale provides approximately 7 milligrams of magnesium, Nuts and seeds, including almonds, cashews, and pumpkin seeds, are excellent sources of magnesium. For instance, 28 grams of almonds contain about 80 milligrams of magnesium, meeting 20% of daily requirements. Whole grains like brown rice, oats, and barley provide both magnesium and fiber, supporting digestion and cardiovascular health. Fatty fish, such as salmon, mackerel, and tuna, are not only rich in omega-3 fatty acids but also provide significant amounts of magnesium, with 78 grams of salmon containing about 53 milligrams. Dark chocolate, aside from its delicious taste, offers around 64 milligrams of magnesium per 28 grams. If dietary intake is insufficient, magnesium supplementation can be considered. However, before starting any supplement regimen, consulting a doctor is recommended to determine the proper dosage and avoid excessive intake. Proper magnesium supplementation not only enhances vitamin D absorption, but also improves muscle function, reduces the risk of cramps, and promotes better sleep quality. Regular vitamin D level testing through blood tests is an important measure to ensure the body maintains optimal levels. Monitoring vitamin D levels allows for timely adjustments to supplementation if needed. Blood tests can help detect deficiencies or excesses, providing accurate assessments of vitamin D status to prevent potential health risks. Maintaining sufficient vitamin D levels supports bone and dental health by aiding calcium and phosphorus absorption, essential minerals for bone strength. Additionally, vitamin D plays a crucial role in regulating the immune system, helping the body fight off infections from bacteria and viruses. Adequate vitamin D levels also reduce the risk of chronic diseases such as diabetes, cardiovascular conditions, and certain cancers. The 25-hydroxyvitamin D, 25-OHD, blood test is the most common method for evaluating vitamin D levels. The procedure is simple, involving a blood sample analysis in a laboratory, and the results indicate current vitamin D levels, allowing healthcare providers to recommend appropriate dietary adjustments, sun exposure strategies, or supplementation if necessary. The frequency of vitamin D testing varies based on age, health status, and risk factors. However, for adults, an annual checkup is generally recommended to maintain optimal levels. Based on test results, doctors may suggest several approaches to optimize vitamin D levels, including consuming more vitamin D-rich foods, such as fatty fish, egg yolks, beef liver, and fortified dairy products. Increasing sun exposure can also help boost natural vitamin D synthesis, although this ability declines with age. When dietary and sunlight sources are insufficient, vitamin D supplements may be necessary, with a recommended intake of 600 IU per day for adults and 800 IU per day for individuals over 70. However, consulting a doctor before starting supplementation is crucial to avoid excessive intake, since magnesium is essential for activating vitamin D in the body. Ensuring adequate magnesium levels through diet or supplementation can enhance vitamin D absorption. Regular vitamin D testing is a key aspect of overall health maintenance, allowing early detection and timely correction of deficiencies or excesses. By ensuring sufficient vitamin D levels, individuals can optimize their body's function, reduce health risks, and maintain overall well-being. Consulting a doctor helps determine testing frequency and appropriate supplementation strategies tailored to individual needs.